All right, all the talk, all the rhetoric finally came down to this. Congress approves its health care bill. Take a look.
Those in favor say aye. Aye. Those opposed, no. No. The ayes appear to have it. Mr. Speaker.
Yes, they did, but by a very narrow vote. In fact, only one Republican voted yes for reform, and we have him. That person is Representative Joseph Gao. He broke ranks with his party, and he joins me now live. Representative, I really appreciate your time this morning. A lot of people do want to hear from you today, since you are the only Republican who voted for this. First of all, tell me, why did you vote for it? Because in the days leading up to it, all indications were that you were pretty skeptical about this bill.
I was skeptical of the bill, particularly with the pro-abortion language. And I have stated previously that I could not support a bill unless it has strong language prohibiting the federal funding of abortion. And when that was worked out at the late hours of the night on Friday night, then I was contacted by the White House, or actually I called the White House and said I could possibly support the bill because I have a constitutional duty to make the right decisions for my district, whether or not the decision was popular.
Was that your only sticking point? Because the amendment to that essentially says that it would eliminate abortion coverage except in the cases of rape, incest, or if a woman's life is in danger. Was that really the only sticking point for you?
No, there were other issues that I was concerned with in regards to the bill. For example, the Medicare cuts, how it will affect small businesses. But in Congress, as you know, we will never get a perfect bill, and I had to make a decision, and I felt that last night's decision was the right decision for my district, even though it was not the popular decision for my party.
No, it was not. In fact, Republicans are criticizing this bill, and I want you to take just a listen right now to what Representative Tom Price of Georgia, in fact, had to say.
This bill is an affront on the morality of the provision of American health care. As a physician, when patients and their families and their doctors are not allowed to independently decide what care should be provided, we lose more than our health care system. We lose our morality and we lose our freedom.
Also, the GOP national chairman says that this health care bill is an experiment that is going to increase health care costs for families, increase the deficit, increase taxes, and cut Medicare. I want to get your reaction to that in consideration of the fact that you voted for this.
Well, obviously, this is a very complicated bill, and there are a lot of uncertainty with respect to the bill. But at the end of the day, like I said before, I had to make a decision of conscience based on the needs of the people of my district. So I made the vote to support the health care reform bill because a lot of my constituents are uninsured, a lot of them are poor. And it was the right decision for the people of my district.
Okay, with that being said, you are a Republican in a heavily Democratic district. Was this vote as much about your political future as it was about your interest in health care reform?
Betty, since the very first day I've been on the Hill, my decisions have never been based on my political future or the popularity of my vote. I have always emphasized the need to achieve the right solution, to reach the right solutions, and to make the right decisions. I've made some very unpopular decisions in my district before. For example, the stimulus vote and the cap and trade vote. Even though those decisions were unpopular in my district, it was the right decision for the district. And for this decision, even though it was unpopular for my own party, but it was the right decision for my district. So I've always been focusing on making the right decisions for the people of my district, whether or not it will cost me my political future.
Yeah, no doubt it was a difficult decision. I want to get your reaction, though, or find out what kind of reaction you, in fact, got from some of your Republican colleagues. Have you heard from them? What are they saying about your vote?
Within the leadership, obviously, they respect my decisions, and I respect theirs because we are in a very tough environment. And to tell you the truth, neither one of us really knows what is ultimately the right decision. There are mixed reports out there, mixed studies, and oftentimes we just have to ultimately make that leap of faith. And for me, I made the leap, and it was to support the health care reform bill.
How much of a role did the president play in your decision? Because in your written statement last night, you said that you obtained a commitment from President Obama to address the critical health care issues of Louisiana. Did the president really weigh heavily on you? And was this an issue of where, look, I'll give you some funding, some of the things that you need if you give me the vote that I need?
Betty, the president and I, we have had a very good relationship, and I thank him and his administration for their hard work in helping me to rebuild my district after the devastation of Hurricane Katrina. And I'm pretty sure that if I were to vote no against the bill, the president would still continue to work with me to address the needs of the district. But I felt that it was important for me to support the president in this matter because like I said before, based on my own conscience, that it was the right decision for my district. And I just want to, again, to convey to the president of my support and requested that we continue to work with one another to address the needs of my district, as well as some of the other needs of the Vietnamese American community in the United States.
All right. Well, Representative, I'm Joseph Gao. Thanks so much for your time today and providing us with some insight on why you placed that lone vote. Thank you.
Thank you, Betty.